Dr. Khan, last week we talked about the COVID-19 vaccine rollout in Manitoba with Dr. Anderson here in Winnipeg. We're going to go west this week. What's in store for the rollout in Saskatchewan?
So vaccine is the COVID vaccine, both the Pfizer and Moderna is currently is being rolled out in Saskatchewan First Nations, and it's already been in circulation in many provincial sort of jurisdictions. But since last week, it's now been, since last week, particularly in the South Central area, but in the North, the vaccination started way earlier. So currently, a number of South Central First Nations communities and the Northern communities are getting the COVID vaccine. So starting with the priority groups that has been identified here provincially, we also were able to get the 40-year-old and above Indigenous people also prioritized for the COVID vaccine. Mm-hmm. So with that good news, Saskatchewan is the first province to prioritize Indigenous people 40 and above for the COVID vaccine. So that is certainly another sort of added news to the overall COVID vaccine situation in Saskatchewan.
Yeah. How are the numbers in Saskatchewan? Are they leveling out?
No, unfortunately not. The numbers are way up compared to the last year, and especially after the New Year and Christmas break. There was a little bit of dip in the number of tests and the number of cases, but we knew that is going to happen. Yeah. But in the last 2-3 weeks, we have seen a huge jump in the number of cases. So currently, and I'm just sharing with you the First Nations number, right. Particularly the First Nations population on reserve in Saskatchewan is of today 3,500 cases to date or diagnosed in First Nations communities. And of that, majority are still active, and we have 22 unfortunate deaths due to COVID situation, but also the hospitalization rates and the number of people in ICU is another concerning indicator we are watching in the last 3-4 weeks.
We were hearing last week too, in northern Manitoba, lots of people had not been isolating and staying away over the break. There had been gatherings, and in Manitoba, it's the same thing. We're seeing a spike in numbers. We had a lot of questions from viewers with regards to the COVID vaccine that hopefully you can answer for us. One viewer asked, can I visit my 94-year-old mother after she's vaccinated, or do we both need to be vaccinated in order to see each other?
Yeah, it's a very good question, and my advice on that is that the grandma first definitely need to be vaccinated, but any visitors, and particularly the family, the caregiver also need to be prioritized and vaccinated. Mm-hmm. So in this case, both are accredited. Very important that they have the vaccine. Also, you have to wait a little bit before you get after you get the second dose of the vaccine. So the immunity takes some time to develop after the second dose. So I would suggest that waiting for a couple of weeks after getting the second dose, then certainly if the grandma and the caregiver or the family members want to visit, certainly that can happen. But I would still suggest that the COVID precaution should be observed, particularly, the fact that you have the vaccine and immunity does develop. But still masking, distancing, hand washing, those sort of things, and particularly if you're symptomatic with whatever sort of infections, whether it's viral or bacterial, I would suggest that caution should be observed while visitation.
Another question, somebody asked, could people who refuse to be vaccinated be restricted from things like travel or anything else? Is that something that's being discussed in the medical community?
Well, a lot of things is going to be changing as we roll out the vaccine in a broader population. So certainly some things may change. It's hard to say that at this moment, but what I know is that vaccine is certainly a good thing to have if you're traveling to any country or any area domestically or internationally. But if somebody refused the vaccine, certainly the test of COVID test certainly would be required. Going to your destination, particularly, you would have to check that which country are you going to. So every country has a different requirements, and Canada has requirements on arrival that you should have a COVID test results within the last 3 days available on arrival. So those sort of requirements are clear at this moment, and certainly as we move, we will see what other requirements would be in place for travelers if they're going out or coming in.
Well, Dr. Khan, thanks for taking time out of your busy day to chat with us. We really appreciate this insight.
Thank you so much. Take care.